with a special edition of The Scoop for Mason County Press, brought to you by Spectrum Health. And today I'm joined with a couple health and county people. I'm going to have you guys all introduce yourselves because we're on Zoom, so we're not sitting together at the same, table or anything this time. So Helen, I'm going to start with you. You want to introduce yourself and kind of who you are and your background?
Sure. Hi, I'm Helen Johnson. I'm the Chief Operating Officer at the Spectrum Health Ludington Hospital. I'm originally from this area, and I've worked here at the hospital for about 15 years.
Great. Okay. Liz, let's move on to you.
Hi, I'm Liz Riemink. I'm the Mason County Emergency Management Coordinator, and I've been in the position for about 13 years. Not original to the county, but this is home now.
Cool. All right, George, you're last but certainly not least.
That's good. Hi, I'm George Davis. I am one of the clinical supervisors with District Health Department number 10. I'm a registered nurse. We cover the Mason County area, and we also cover a total of 10 counties here in northern Michigan. I've been with the health department for 10 years.
All right. So Liz, we're going to start with you. What is the county doing to prepare and kind of manage the whole coronavirus COVID-19 pandemic?
The county's been taking a lot of actions well before we had coronavirus here in the county, but we've been working with our partners here at Spectrum Health Ludington Hospital and the District 10 Health Department. But a lot of it is just kind of pulling out the pandemic plans that we had in place prior to this and customizing them to the coronavirus impact specifically.
Okay. And then how are the agencies all kind of coordinating together to take this on?
I think it's important to note that it is a heavy lift and that this is a big pandemic, not just in Mason County, but in Michigan and nationally and internationally as well. So it's important to note that the three agencies have been working well together and that we're all addressing different facets of the pandemic, but we're addressing them collaboratively. So health department, hospitals take lead on the medical side and are facing the brunt when we do have positive cases. But then we have a full wraparound approach as county emergency management to make sure that everybody is working together and that no segment of the community or no issues falling through the crack.
Okay, cool. Oh, excuse me. George, I'm going to jump over to you now. And can you tell us a little bit about how the coronavirus is actually contracted? I think a lot of people kind of are still in the unclear zone of that.
That's a great question. I think one of the first things to wrap our heads around is that the COVID-19 or the coronavirus is fully at our mercy to spread. It does not have its own legs, its wings, its arms. We are the ones who manage to pick it up, and then we bring it to our bodies and ingest that somehow. So let's talk about how that happens. It is spread typically through droplets, meaning somebody coughs, they speak, they sing, and they're infectious. Those droplets land on a surface. The next person comes along and they touch that surface. It could be their cell phone is laying down, they pick it up and somebody sneezed on it, they rub their thumbs on it, and next thing you know, they rub their eyes, their nose, their mouth, and then it finds its way into our body and then is able to go into a respiratory tract where it replicates and causes disease. So some things to just kind of to know is typically it's kind of, we think about it like flour. If you threw flour up in the room, think that's a sneeze. It'll come and it'll eventually settle onto a surface, and then that surface is contaminated. So that's why we want to decontaminate those surfaces. It doesn't linger in the air usually for a long period of time. An example would be if somebody smokes in a room, you can smell that smoke for a couple hours later. This is much more like a flower, and we pick it up and we touch our faces, and that's how it gets in our body.
Okay, makes sense. I mean, that's a good analogy. Okay, Helen, now I know a lot of people are wondering about testing and local testing and that kind of thing. So can you talk to us a little bit about our tests available at Spectrum Health in Ludington?
Yes, absolutely. Testing is something that a lot of people are really concerned about. There's a lot of conversation about that, and testing is absolutely available at Spectrum Health Ludington Hospital, and we have been doing testing for several weeks.
Okay, and what does that process look like with the testing?
So the testing itself, and playing out from what George was talking about, is the virus lives in your respiratory and nasal passages. So this sounds a little strange, but we take a long Q-tip type device and stick it up your nose and really get in there and try and find that virus, and then that is taken to our lab.
Okay. And how many tests are you guys doing? Like, why isn't it done with every single person that comes in? Another thing I think people are kind of confused about, because I know there's only so many to go around, and symptoms look different at different levels of, you know, contagiousness, illness. Yes, I was at a loss for words. So why aren't they just automatically done like every time somebody comes in?
Yeah, and that's similar to any of our testing, is really at the discretion of the ordering physician. And the tests, I mean, this is a national, international, as Liz was saying, pandemic. And a lot of the testing supplies themselves are in very short supply. Some of these testing supplies are made internationally. So that swab that I was talking about, a big percentage of those swabs are actually made in Italy. So you can see why maybe there's a little bit of trouble getting some of that product out. And then currently that testing, we're following the recommendations from the health department, and they're getting that from the CDC. So currently testing is really reserved for those patients that have severe symptoms or people that are most vulnerable. And not everybody needs a COVID test.
Okay, that makes sense. So if they do feel like they might have symptoms and they come over to the hospital, where do they go? What should they do?
So the process for that actually starts most often pre-hospital. There's steps to getting that testing, and there's an 800 number, a free screening that you can do through Spectrum Health, and the phone number is 833-559-0659. Now that's a screening, and then the screening will lead into an actual visit if necessary. And then if you have that visit and they decide that you need testing, they would actually make an appointment for you to come over to the hospital, and you would get that test taken in our ER. Unless you are sick enough, and certainly if you are sick enough, please come to the ER. If you are having any severe symptoms, please come to the ER, and those tests are available if the provider feels that you fall into that category.
Okay, and then from there, let's say somebody comes in and tests positive. What steps then happen after that?
So we have had people test positive, and depending upon the severity of the symptoms that they're having, some of them just go home and self-quarantine, and then some of them might be sick enough where they would actually have to come into the hospital and stay in the hospital. Currently, we have done to date, as of Easter Sunday, 105 tests here at the Ludington Hospital.
Okay, and can you touch a little bit on the quarantine at home? If people are sent home, kind of what they need to do, what they should know, what family members, if they're living with somebody, should know?
Sure, and that's probably a better question actually for George.
Okay, George, we're gonna swing it over to you. Yeah, if you are testing positive but get sent home, what does that look like?
That's a great question. And sometimes patients do get discharged from the hospital. Even though they're still infectious, they just don't meet that criteria to stay in the hospital in the bed. They can certainly go home to rest. We would consider a person to no longer be infectious 7 days after their symptoms began and 72 hours without a fever. So sometimes people may be considered infectious for 9 days because that fever, we really would need to make sure that they have been gone 3 days without a fever, those 72 hours. But I also have some patients who after 7 days, that fever is broken for 3 days, and they're able to carry on with their normal routine. When people are actively infectious, we do have a team of nurses here who are in contact with them to make sure they understand quarantine, how to reduce risk of spread to others. And also, if there's people in that home who may have been exposed, we have a team of nurses who work with any of those really close contacts to say this is what they need to do now to make sure that they're not spreading the virus as well. So the health department is in close contact with these folks and the hospital.
Okay, and that brings me to my next question, so I'm going to stick with you.
Okay.
Healthcare providers, what are we doing to keep them safe? Because they are the ones that are coming in contact over and over and over with people who are infected. So what are you guys doing collaboratively to make sure that they're being as safe as possible?
Sure. So speaking from the health department point of view, we are able to work with the state and federal partners. There's something called the Strategic National Stockpile. and they are able to work with our regional healthcare facilities to make sure there's enough personal protective equipment. The health department also has a small pile set aside of personal protective equipment that we have been able to give to our facilities locally to help carry them through. So that's both through the hospital. There have been some AFCs that have needed some help along the way, just to kind of give them some of the very essentials until their other supplies can come. That is one way. We also have a very close working relationship with our county emergency managers. And we do have an internal incident command team with a medical director, epidemiologist, a team of nurses, environmental health folks as well, to make sure we're assisting those hospitals.
Okay, and then how do people know if they might have been to a place where they have been sharing things with somebody who has contracted the COVID-19?
That is the question that we get asked the most. So I'm so glad you brought that up, and I hope this will help clarify and maybe alleviate some anxieties for folks. Again, COVID-19, it is dependent on us to spread it ourselves. So somehow it has to find its way into a respiratory tract. And the way that would happen unintentionally through other people is through close contact. So we're in the same room with somebody who's coughing or sneezing. And we're in that same room for a long period of time. Usually we'd say maybe an hour, but then there's also a close contact. We want to make sure they've been within that 6-foot range with us as well. And so there's numerous little nuances and intricacies that we follow through on these, more than I can explain in this video right now. But if we know somebody was a contact or met close contact definitions, we would personally have a registered nurse from our agency call those contacts, let them know what their exposure level was and that they were a high-risk exposure. And then we would help that person understand what a 14-day self-quarantine is. Meaning for 14 days, that person needs to stay home, monitor for symptoms. There are some exceptions there for like healthcare workers or first responders to try to get them back out to keep our communities safe. But we do work through and kind of have that personalized plan with them to meet their needs and for the best of our community to try to keep the spread under control. It's important to understand that somebody just walking through a store is not considered a close contact. That is not something that we want people feeling like they need to run in circles and scream about in fear and terror. Really, a close contact is somebody who's you've been around in that close setting. And we are also monitoring those people 2 days before they develop symptoms. So we'll actually go through when their symptoms started. We do 2 days previous to that and say, okay, who else were you also with in those 2 preceding days so we don't miss anybody. Now, that's what we do with close contacts. Again, I have to restate the importance of assume that COVID is on any doorknob, any shopping cart handle, anywhere else in the community, and wash your hands. So you don't get a call from us, you can still be exposed through community spread.
Okay, and besides washing your hands, those personal protection equipment, what does like the proper look, what is it, using them properly look like in the community? I know a lot of people have been wearing the masks. There are different types of masks. People are wearing gloves, people aren't wearing gloves, all those things. Can you talk a little bit about what you should be doing, what you shouldn't be doing, that kind of thing?
I would love to do that.
All right.
That's great. And I brought props, so
awesome.
Bear with me here real quick, all right?
I love a prop. I love a prop.
That's awesome. So there's been a lot of discussion lately about the homemade masks made out of cloth compared to the official N95 respirator that we'll see healthcare providers, paramedics, or first responders, hospital workers using, and surgical masks. So these are kind of the 3 masks that we're seeing out and about right now.
Okay.
The big thing that we are seeing we are asking folks when they're going out that they can wear that cloth mask out in the community. A cloth mask is basically, how I think about it is, it's like when I sneeze or cough, I go into my elbow. It's kind of like putting that elbow on my face, okay? It's gonna try to catch some of those really big droplets and keep them close to me and not out my 6-foot radius or landing on door handles and shopping carts where somebody else may touch that, then itch their face and infect themselves. So really, these masks are not meant so much to keep us healthy as they are to keep others well and prevent us from infecting others. Because remember, you could be infectious before you even have symptoms. All right. Now, when we talk about the surgical masks and the N95s, we frequently will have patients wear a surgical mask if they are infectious, and we know they're infectious because it helps prevent their droplets that we know have the virus in it from coming out and spreading. Our first responders and our medical workers use these N95 masks to help them prevent from inhaling that virus. So I know a lot of people in the community really want to use this N95. It's like, it's good enough for the doctor, it's good enough for me. But something to remember is our healthcare workers need these special tools because they're within that 6-foot radius of infectious patients who are breathing and coughing directly in their air space. That's why we need this filter for them. As we go about our day-to-day business, we really, these cloth masks can be used, but they're also used in conjunction with that 6-foot radius. So it's not that, again, they're preventing us from inhaling, they're preventing us from expelling. So these in conjunction with 6-foot radius are the general recommendations. A brief analogy is when you go to a bonfire, you don't stop at the firehouse and get a fighter's gear to go to the bonfire to protect yourself, right? You just move your chair back a ways from that fire because we have to keep that equipment for our medical people, or in this case, our firefighters. So when they have to go into a burning building, they have it. That's where these N95s, we're asking that we're keeping them for our health workers and our first responders. And these, if you choose to wear a cloth mask, you can do it safely.
So along with the masks, talk a little bit about the importance of washing your hands. I mean,
Sure.
Soap and water is, they say, is the best thing. That at least 20 seconds, pick your favorite childhood song and sing it in your head a couple of times while you're washing your hands.
Yes, ma'am, you nailed it. You really can't beat good old-fashioned soap and water, and make sure when you're scrubbing, you're getting under those nails, you're getting between those fingers, and just, I mean, really give her, because those viruses can even after you rinse, if you didn't wash really well, they can stay on your fingers. And that's important, not just for COVID. You know, you're talking influenza, you're talking foodborne illness that can make you throw up, all sorts of awful pathogens, right? You can, if you're lucky enough to still have hand sanitizer and can find it, you can use that. Hand washing is still preferred. You know, when I think of hand sanitizer, I think, do you really still want all those dead organisms on your hands? It's nice to be able to wash them and get them out of there, right? Also looking at, some people have wondered, okay, I'm having a hard time finding disinfectants and cleaning solutions and things like that. So the CDC's website does state that you can use 1/3 cup of bleach per 1 gallon of water. If you want to make up your own solution at home to clean up those door handles, you don't want to go out, you know, and spread that. The other thing that I frequently see people, they're walking with gloves on their hands.
Mm-hmm.
So just wash your hands. Gloves are not necessary out in the community. And a lot of times what we're seeing with those gloves, folks they get out of their car, they put their gloves on, they go in, they touch the shopping cart, then they grab all their food and they put in the shopping cart, and then they go to the checkout, and then they pull out their wallet and they touch their wallet and they get their card and they swipe it and they put their wallet back in and they grab their phone quick with their gloves, get back out to the car and they take their gloves off, and then they touch their phone, their wallet, all their food. So really, I mean, gloves are meant for a one-time, one use. So like when we're at the hospital, we wear a set of gloves, we take care of a patient, we throw those gloves out. You know, we don't walk around the unit with them. And that's the same thing out in the community. Really just be washing your hands and using hand sanitizer. That's really the best you can do. Some people have asked about, you know, sanitizing these masks. I don't have huge guidance on how to do that. There are resources available through the CDC. And part of it is these masks are being made out of different materials. There's no universal standard. So I don't want to give a universal guidance, with the exception of one mask belongs to that one person. Like, this will be my mask now forever. And I want to make sure I'm not sharing it with other people, and then it's not coming in contact with other people because it has my respiratory droplets on it.
Right.
Yeah.
What about the sanitizing of the groceries and the packages that, you know, you're picking up at the stores, somebody from Shipt is bringing in, or FedEx is dropping off at your house? Right. There's been kind of confusion and different things being told. So what is the right thing?
Okay, that's great. So to remember that coronavirus, or COVID-19, is a respiratory illness. There is not evidence at this time showing that people are contracting it because of their groceries, or even because you know, they're carrying an envelope that was in the mail, that sort of thing. You can still wash your fruits and vegetables. You don't need to use soap and water with them. Just wash them as you typically would. Would recommend you wash your hands before you wash your fruits and vegetables to make sure there's nothing dirty on your hands that you may inadvertently put on your fruits and veggies when you wash them. Your non-perishable containers. There have been folks out there who have said, well, leave them out in your garage for 3 days if they're shelf stable. I'm not telling you that you have to do that. It's certainly not going to hurt anything if you have the space to do that. But there is no evidence to show that bringing those containers into your home and putting them away is going to give you a higher risk of COVID-19. And it's also not spread, it's not foodborne. So there's another good thing. We can still eat. I know we're all in quarantine. We all really love to eat when we're stuck at home or working from home. It's one of our favorite things.
I know.
Promise you can do it safely. Okay, it's all about the hand washing and, enjoy. So, yes.
Yeah, all I've been doing is eating. So that's been awesome. I'm kind of glad that these Zoom things, they kind of, cut out anything that anybody else has to see. So,
that's right.
When they see me back in the community, they're like, oh my gosh. Hopefully not. Right. So I'm gonna put out a question for all three of you again. Is our hospital and is the county, are the communities actually prepared? Are we prepared? Are we taking this on the right way? I mean, let's see, there's an influx in the next couple of days, weeks. How are we sitting right now? Helen, you want to start with that maybe?
Sure, I can start from the hospital level. As Liz had said previously, and George had talked about using incident command, this is something that the hospital has been engaged in for quite some time, partnering not only with the Grand Rapids Spectrum Health System, but also some of our partners along the lakeshore that are also in healthcare to understand what our bed capacity is, what our ICU capacity is, and what our ventilator capacity is, and then trying to match that up with, do we have enough providers? Do we have enough physicians and nurses, and then enough supplies? We are confident that with the social distancing that our communities, I know this is tough for everybody to stay at home and distance yourself and wash your hands all the time and do some of these things. That is really what's helping us flatten that curve, as we keep hearing that term being used, so that our healthcare systems are not overrun and we are prepared and able to meet the needs of our community. So I feel that we are prepared.
Okay. George, do you have anything you want to follow up with that, or?
I would just like to reiterate that I feel that we are prepared. I think we are prepared as a community. We have some wonderful community partners in Mason County, working with Spectrum and working with the emergency management at the county level. Also working within Central Dispatch and the important work they're doing with our frontline first responders out there. There is a really close network of folks in Mason County, and that's really awesome to be a part of that, even though I'm at a distance here with the health department and to witness this happening. From the health department standpoint, we have brought in some additional nurses who are home visiting nurses that did visits that they're no longer going out to the home. So they have some free time to help us with their case follow-up, to contact patients who may be infectious, answer questions. So right now our staffing looks really good. And I think we have a good relationship with the community players who we need to work with as we mitigate this. So I think the community can rest well.
Sure. Liz, do you have anything you want to add?
I would just agree with Helen and George that yes, Mason County is amazingly prepared. Our community has been doing a great job with the social distancing. We ask them to continue to stay home and to continue to limit their activities so that we don't see a spike in cases. But the partnerships have been really amazing, not just amongst all of our emergency response agencies and the hospital and the health department, but everybody from businesses to other community leaders have all been stepping up to make sure that we have what we need as a community and as a county, but then also we're taking care of each other. And that's the most important thing as well. I know George is probably working long hours, Helen's working long hours, I'm working long hours. And so we're all keeping tabs on each other as well, and making sure that we are prepared individually and so we can prepare and take care of our community.
Sure. And as far as the information for Mason County, where can people go to find accurate, up-to-date information?
The best place to go for anything coronavirus related is the state's coronavirus site, which is michigan.gov/coronavirus. Or I'll really help promote the health department's information, which is DHD10, which is the number 10.org. Those are going to have really the overall best picture for coronavirus as far as the impacts, the numbers, the press releases, and a lot of the frequently asked questions. We aren't putting out our own information as a county because we want to echo the expert, and that's health department for us and the state.
Okay, that makes sense. And one last question for you. what can the public do to help? I know there's always, we live in a really good community with so many people who are reaching out, to band together to help at, these times of need. And I think I know what you're going to say, Liz, but I would like you to tell everybody that's watching, what can the public do to kind of help out with the coronavirus spread?
The number one thing is to stay home. The number one thing is to adhere to the executive orders and the CDC and health department guidance, and that is to stay home and to limit your contact. And for me personally, that means that I no longer get to see my mother in person because she is a high-risk cancer patient. And it's incredibly hard, but it's for the best of our community for us to all take the sacrifices now, and to make sure that we're not dealing with this throughout the summer. The number two best thing anybody can do is reach out and do your part to be social from a distance. Last night, I wrote a dozen cards and just mailed them to anybody in my life that I haven't had a chance to connect with via phone because I'm so busy. Even though Hallmark writes things better than me, just simply signing my name and slapping a stamp on a card hopefully will brighten their day. Reaching out and talking to your neighbor from your front porch while they're on their front porch is great ways to strengthen your community and neighborhood. So stay home and distance yourself, but be social where you can, whether that's by doing Zoom with family or phone calls, texts, handwritten cards, handwritten notes, making cards for our vulnerable populations. Don't let this time of isolation isolate you. Everybody does need that outlet, and so find your way in your niche, in your community to help out, but make sure that you're following the guidance and not putting others at risk.
Okay, well, I want to thank everybody for joining me today, Liz and George and Helen. Some great information for our viewers, and just like everybody says, wash your hands, stay home, and keep educated because stuff is changing all the time. So again, thank you guys so much for joining me today. I really appreciate it. And I really appreciate what you guys are all doing out there because you don't get to stay home. You are at work. So that's something people need to remember too, that there are still all those people out there that are, fighting the good fight on the front lines of the coronavirus. So for any other information, check out MasonCountyPress.com, and our weather is always brought to you by Smith & Eddy Insurance. And again, wash your hands. It's the best thing you can do to try to keep the coronavirus from infecting you and infecting your loved ones.